Hi, this is Dr. Egelum here at Creekside Oral Surgery and Dental Implants. Today I want to talk to you guys about dental implants and give you a little bit more insight on how I do dental implants here in my practice. So if you've been doing any research on dental implants, you're pretty much aware that dental implants are titanium or sometimes zirconia, and they're placed in your jawbone and allowed to heal over a period of time. And once it's healed, you're able to place teeth on top of those implants, and you can get your natural looking teeth back pretty much using dental implants, right? However, there are different ways of placing dental implants. So when I started placing dental implants 10 years ago, how I learned was to take an X-ray or CT scan, evaluate it, and then you place the implants using your free hand. So you're kind of just eyeballing it and making sure you're placing the implant away from any kind of vital structures, or such as nerves and sinuses and other teeth roots. And after you finish placing the implant, you take an X-ray to confirm that you've got the right angulation and position that you want the implant in. All right. So it's great. It works. However, the human eye is, only so accurate, and there's always room for slight deviations in the plan that you initially set out to do. Right. To make things perfect or as close to perfect as possible, I now utilize a 3D navigation system, which is an implant guided system that actually helps me plan the implant and position the implant exactly where I plan it using the actual patient CT scan. So how it works is I take the CT scan. I also take an intraoral scan, which is like a digital impression of the patient's teeth. And using the patient's teeth and the CT scan, I can actually plan the perfect position of that implant. And using my navigation system, it allows me to place that implant in the exact precise location that I planned it. So it takes the guesswork out of implant placement. So not everyone uses guided implant placement. It makes the implants more accurately positioned if you're guiding your implant. So my recommendation to you is, if you're looking for dental implants, make sure that the doctor that's placing your implant actually guides that implant placement. So don't just rely on freehand placement. Yes, in some cases, freehand placement is great and it's fine because you have a lot of bone. Why not get the best results if you have the ability to do it, right? So I can place implants all day long and I'll be successful 99% of the time. However, using a guided system is always going to make me that much more accurate and give my patients a much better outcome. All right. If you have any questions about dental implants or guided implant placement, you can comment below or send us a message and I'll be happy to respond. Take care.